So as we're talking about hormones, there's one thing that I like to point out is that hormones are like other things in the body as far as in we need the appropriate amounts of hormones. So the physiologic amount that our body would naturally produce, that's our goal for any hormone. We don't want too much, but we also don't want too little. We like to call almost like a Goldilocks effect. We want that in the happy medium in the middle. That's the amount of hormones that we want to actually give us the most benefit and the least risk. The first one I'm going to talk about is estrogen. And what I like to tell my clients is estrogen is one of those things, it's very protective. All of our hormones are protective. And as we discuss through the next few weeks, we're going to kind of go into what they do and how they protect, but you're going to see a lot of overlapping. So some things of what estrogen does, progesterone also does, and so does testosterone. But first of all, I want to talk about estrogen. So estrogen actually helps to improve and decrease cardiovascular risk, which is huge in women as we age. As we know, that's one of the top things that can kill women past the age of menopause is cardiovascular disease. So this can actually help to decrease that risk. It also is very brain protective. We have estrogen receptors in our brain, and it helps with memory. The other thing that it helps with is bone protection, helps prevent osteoporosis, osteopenia, which is destruction of bone. Another benefit of estrogen is lubrication. It is actually known as our lubrication hormone. So not just vaginal lubrication, but we can talk about mouth lubrication, eye lubrication, but an important one is joint lubrication. We start to lose that as we age because our body stops producing estrogen. So not always do you always end up with osteoarthritis or arthritis, but sometimes those symptoms can be improved with just giving the body back a small amount or low dose of estrogen to give that lubrication factor back to your joints. It also helps with metabolism. It helps us to keep that fat from forming around the middle of the body. Because what happens is our body is so smart that what it thinks is as we stop and the ovaries stop producing estrogen, or you've had a hysterectomy with your ovaries taken out and your body no longer has that production, your body stores estrogen in fat cells. So what it does is it knows that it's not getting it, so it feels that it needs to start making more estrogen, or at least helping the body by producing more fat cells, because the body knows that estrogen is stored in fat cells. So it starts producing more fat cells to help with estrogen production, which we all know really doesn't work. But the body is trying to do what it can to protect itself. The also other important factor of estrogen, as it does help with gut health, as all hormones do. We have receptors for all of our hormones in our gut. That's why our gut and hormones are directly related. So as you can see, there's a tremendous amount of estrogen, and I know many people are very afraid of estrogen, but I feel that you need to get all of your facts and of the benefits and risks, and then make the best decision for you. I can give you that education, but ultimately it is your decision of which route you want to go if you want to do that. Again, this is not something that I push for clients. I give them all of the information of the testing that we do, and then I want them to make an educated decision on the way they want to more or less go through life, and for them to have the most protective and preventative measures possible.